Mr. Torres, how's it going today, sir?
Go on, man. How about yourself?
Doing good. My name's Dr. Torres. I'm going to be your student physical therapist today. Is it cool if I call you Mr. Torres? Do you go by your first name, Mr. Torres, sir?
Noah, please.
Noah. Okay. All right, Noah. Well, starting off, can I get your age, please?
25.
25. And is it cool if I write down information while I'm asking you any questions, my man?
Do your thing, man.
All right, Noah. Who referred you today?
My primary care physician.
All right. Okay. Nice. And your diagnosis?
Right shoulder pain.
Right shoulder pain. All right. So we got Noah, age 25, referred by his primary care physician with right shoulder pain. Occupation-wise, are you doing anything currently, day-to-day operations-wise, hobbies, job or anything like that?
I work for Amazon. I'm a delivery driver.
Okay.
And then I do jujitsu.
Okay.
As well as lifting weights and running and stuff like that.
All right. So you're pretty active then, I'd say, huh?
I try to stay active, yes, sir.
All right. So Noah, going back onto the right shoulder pain issue, could you tell me a little bit about that? When did this start happening and when exactly?
It started when I sleeping actually. Like I had I did jujitsu and stuff the day before. I didn't have issues before that, and then I just kind of woke up. I was sleeping on my side, and it felt sore, and I started feeling a little bit of pain in the front of it.
Can I ask you a question? Do you sleep on your side by any chance?
Yes, like unintentionally, unconsciously, I roll over to the side and usually end up staying there, and I wake up in that position.
So you're normally starting on your back though when you fall asleep?
Yes. Yeah.
Okay. All right. And locations of the symptoms. So we got right shoulder pain. As far as location wise, are you feeling any sort of radiation? I want to say probably closer to the elbow. Does it go down the arm at all?
No, it's just in the front part of the shoulder.
So pretty localized then?
Yeah.
Okay. Can you describe the pain for me? Such as constant pain, throbbing, could be sharp shooting, maybe a dull ache.
It's just a dull ache. It's usually just when I go overhead that it starts bugging me.
So, question on that: is it hurting when you're going forward ahead, or is it more so abduction to the side overhead?
It'd be abduction.
Okay, so fully, kind of more so full extension overhead.
Yes, I don't have any problems in front, but it's abduction.
Okay. All right, and we got a dull aching sensation. If you had to rate that on a scale from 0 to 10, 0 being it's great, 10 being it's absolute worst, what are you currently at?
I'd say I'm probably at it's a 5. It's just more annoying than anything.
But you pretty much could put up with it day-to-day operations wise.
Exactly, yes.
Okay. All right, Noah. And then as far as aggravating or relieving factors go, is there anything that you've done other than the abduction overhead that you notice that can be aggravating, such as, I don't know, lifting weights maybe doing some overhead presses, does driving give you any issues, anything like that?
Not for the most part. Usually it's just overhead things. Like I laid off the weights since this ache started occurring, so I've been staying away from overhead presses and stuff like that. So basically, just when I'm on my side, kind of like when I'm sleeping or in jujitsu, if I end up on my side, then that's when it bugs me, or when I lift my arm over my head. But other than that, it's usually good to go.
Okay. And is there anything that's provided you any sort of relief at all? Such as it could be ice, it could be specific movements that you do to just take a little bit of the tension off the shoulder a little bit.
Ice for sure. Ice, and there are a few exercises that I do to.
So like internal, external rotation, you'd say?
Exactly.
Okay. And then how many times a day do you typically ice, or do you just ice occasionally?
I ice occasionally.
Okay. All right. And then as far as behavior of the symptoms go, when it comes to pain, when are you feeling it most throughout the day? Is it more so constant throughout the day? Do you feel more so in the morning when you wake up? I know you mentioned you're sleeping on your side. So when you get up, are you feeling?
Yeah, it's mostly when I wake up.
Okay.
It starts in the morning, and as the day progresses, it gets better because obviously the pain is usually just from
So better with more activity a little bit when it
Yeah.
gets warmed up.
when the blood's flowing.
Okay. Cool. And then I'm gonna scale it back even a little bit more here. So have you had any history of trauma in the past? Not necessarily the shoulder that we're talking about in the present case, but as far as anything in particular, like surgeries, any other injuries you've had in the past, even if it's the same shoulder, you could think back even to high school.
Popped. Well, both of my shoulders had been dislocated,
Okay.
and then,
Bilateral
yes.
shoulder dislocation.
So it popped in and then popped out and then popped back in like immediately.
Okay.
And then I have torn my left ACL and meniscus and had surgery on that around like 2014.
And just to kind of piggyback off to that, so were you medically cleared for both of these injuries?
Yes.
Okay. Nothing else in particular as far as injuries goes? No past trauma other than that that you could think of from sports?
Sure.
Okay. All right. And then now we're going to trickle back to the history on what is currently happening here. So we discussed that we had issues on the right shoulder, more so pain in the front. Have you had issues with this before now?
No, this is the first time where this has become an issue.
Okay. And then you said this started, just to backtrack a little bit, how long ago did this start? You said July?
July. Yes.
All right. And have you had any imaging done, x-rays on the shoulder at all?
I have had some x-rays done.
And they came back negative, everything checks out?
Yes.
All right. And would you say it's gotten better at all, or has it relatively stayed the same? Has it gotten worse?
It's like fluctuated. It got better, then it got worse, or not worse, but it went back to like where I'm at right now, basically. Like it was never, the pain's never been high. The pain is always at the highest been a 5.
So it's been pretty mild.
Mild, yes. It's there. It's just annoying.
Okay. And as far as general health, do you have any certain conditions that I should probably know about beforehand? Cardiovascular disease, diabetes, medications, anything in particular that you can name off the top of your head?
No, sure.
Okay. And social history as far as what you do on a day-to-day basis. So for work, you reiterated that you were an Amazon driver, correct?
Yes.
So with that, it's going to require you to be picking up packages. Usually those are pretty heavy.
Occasionally, it will bug me. It just depends on the positioning of where I'm sitting.
Okay.
But for the most part, I'm able to alleviate that with not being lazy pretty much and making sure that my body's positioned correctly when I pick stuff up.
And would you say that's usually an issue that you have to run into every day when you are going to work?
I just have to be more careful.
Okay.
I just, obviously, I don't lift anything over my head, so I stay away from that. And I don't, like, if it's too heavy, I'll just take it with a what's it called?
The hand cards?
Hand card, yes.
Okay, I got you. And then, so besides work, I know that you said that you're also a jiu-jitsu practitioner and that you're also working on stuff like that. I know you said that you're kind of scaling it down on overhead pressing movements, especially overhead shoulder press. I know jiu-jitsu, you're probably rolling around a lot since it's more so martial arts focused. Has that became a big issue in the gym while you're training?
Well, I'm not sparring as much because I don't want to I don't want to put it at further risk of injuring it more. So, like right now, I've just been drilling. I've alleviated the stress pretty much. Like if usually I don't have any problems in jiu-jitsu, but occasionally like I'll end up kind of positioned like how I am when I'm sleeping on the side and a lot of pressure's on the shoulder. So I try to avoid that by not sparring for now. But that would obviously I want to get back to doing that.
Okay. And as far as family goes, do you have? I know you said it's pretty mild. You said it was a 5 on the pain index scale, but say in a case where it was more so extreme, would you have family or friends around you that could help you if you needed assistance with anything that's kind of hindered by the shoulder?
Yes.
Mom, dad, brothers.
Girlfriend, brothers.
Okay. You got a pretty good support system there, then, huh? All right. And this last question I have to ask you on this topic, you could answer it if you want to. If you don't feel comfortable enough, you could decline. But I was wondering if you had any emotional issues that I should know beforehand, maybe depression. Have you been classified with depression? Are you taking any medication?
No, sure. We're good to go.
Okay. And then I didn't ask you this before, but I thought I'd take a few steps back. Have you gone to physical therapy? Yeah, I know you said it's been a few months since you started feeling the pain. Have you gone to physical therapy at all for the shoulder yet since
Yes.
going? Okay.
So I did, and like I said before, it got better. So I started going to physical therapy, and it got better, and then I stopped going, and then it came back probably nothing but like 2 weeks ago.
So that's what you mean when you say it's fluctuating then, huh?
Yes.
Okay.
So it just popped back up. Like it went away for a cool bit, and then it started happening again.
Okay. And then I have a couple more questions for you here. So as far as the goals that you're trying to achieve by coming into physical therapy now, could you just give me a little bit more info on what you want to accomplish? It could be as far as, or as simple as maybe going pain-free to jujitsu, being able to sleep pain-free, something like that. Gaining strength back in the shoulder. Is there anything specific that you're trying to accomplish here?
Well, for sure, you took the words out of my mouth. I want to get back on the mats. I want to be able to spar. I compete, so I want to be able to do that without having to worry about being in pain in certain positions or whatever. So I want to get back to the mats first and foremost. I also, obviously, I want to continue my strength training. I haven't been able to get after it like I would want to, but so the pain free for sure. I want to get my shoulder back to being 100% healthy, and I know that affects everything in my life. You know, I want to be able to sleep better. I want to not have to worry about things at work. You know, I just want to be healthy, pain free, fellas.
So more so focusing on comfortable range of motion, strengthening up the shoulder again. Okay. All right. So I think we covered pretty much everything that I needed to know. Is there anything else that maybe you wanted to disclose beforehand that maybe you didn't touch on?
I think we're all good, man. I think we touched bases on everything I was curious about.
All right, sir. Well, I'm looking forward to working with you, okay?
Thank you, man.
We'll talk soon.
Sounds good.